Okay, let's look at applied physiology. That is, let's look at things associated with the disorders associated with the gallbladder. And usually it's jaundice. I'm sure you've heard of jaundice. Jaundice, also called icterus, is the condition characterized by yellow coloration of the skin. The skin starts looking yellow. Same applies to the mucous membrane. They start looking yellow, and deeper tissues due to what? Increased bilirubin levels in the blood. Okay. So the word jaundice is derived from the word jaune, which is a French name to mean yellow. So the normal serum bilirubin level is zero point 0.5 to 1.5 milligrams per deciliter. It's normal to find plasma bilirubin, but it should be in this level, zero point 0.5 to 1.5 milligrams. So when the levels exceeds 2 milligrams per deciliter, that is jaundice, which presents with a yellow coloration of the skin, the mucous membrane, and deep tissue due to increased bilirubin levels. You may be asking, where does bilirubin come from? But before I mention where bilirubin comes from, let me show you somebody with jaundice. You've seen this person. This jaundice is associated with bilirubin. Okay, you can see the sclera. Instead of this sclera looking white, it is looking yellow. So when you're doing your physical examination, you check the sclera, you check the mucous membrane and the skin. Now, where does bilirubin come from? And why is bilirubin associated with we are discussing the gallbladder, the pancreas. How is bilirubin coming in? Remember, the composition of bile has bilirubin. We call them bile pigments. Are we together? The bile pigments includes bilirubin and biliverdin. So anything that affects the gallbladder, the biliary system, it can affect the metabolism and the elimination of bilirubin. Okay? So let me start by explaining where the bile is coming from. We know the red blood cell has a lifespan of 120 days, isn't it? So this red blood cell, when it is about to die, there's a mechanism that can entail that it's my time has come for me to die. It's in the spleen. There's what we call the reticular endothelial system. They'll break down this red blood cell into hem and the globin. Okay, the hem and the globin. The globin is proteins. They are reused. Okay. In other words, they are reused to resynthesize the hemoglobin. The hem, meaning there's an ion component. The ion is it's removed and it is reused. The hem is broken down so into ion and porphyrin. I haven't shown the porphyrin here. Okay, but the porphyrin is converted into a green pigment called biliverdin. But in human beings, most of the biliverdin is converted to a yellow pigment called bilirubin. Okay. So bilirubin and biliverdin are together called bile pigments, and these are they make the components of what the they make the components of bile salts. I mean, they make the components of bile. Okay. So this bilirubin can enter into the bloodstream. Okay, and it can move to the liver where it needs to be conjugated. Okay, when it is conjugated, it becomes soluble. Okay, and it can be eliminated via the feces or the urine. Okay, through the urobilinogen. For example, if it's urine, it's in form of urobilinogen. If it is in fecal matter, the bilirubin is in stechobilinogen. So we know where the bilirubin comes from. It comes from the destruction of red blood cell in the reticular endothelial system. And bilirubin, it has to be part of the bile so that it can easily be eliminated because it is insoluble in its nature. So it has to be conjugated to become soluble. Okay. Now we know that where bilirubin comes from. There are three types of jaundice, which is prehepatic or hemolytic jaundice, destruction of red blood cells. There is hepatic or hepatocellular jaundice. There is also posthepatic or obstructive jaundice. I'm interested very much in the posthepatic or obstructive jaundice because this is it's involving the bile circulation. It is involving the biliary system. But let me quickly define prehepatic before the liver. That's what it means, prehepatic. This is a type of jaundice, okay, that happens in structures before the liver. And then hepatic, this has to do with jaundice associated with the liver itself, okay, where the hepatocytes are, maybe the cirrhosis of the liver. So there's improper metabolism of the bilirubin. Remember, bilirubin has to be conjugated. So the conjugation processes are not taking place. But I'm interested in the post-hepatic, which is also called obstructive jaundice. This is a type of jaundice occurs because of the obstruction of bowel flow at any level of the biliary system. The bile cannot be excreted into the small intestine, so bile salts and bile pigments will enter the circulation. The blood contains more amount of conjugated bilirubin. So this is called hyperbilirubinemia, excessive amount of bilirubin in the bloodstream, greater than 2 grams per deciliter. So what causes this? Gallstones are the major causative agents and cancers of the biliary system or the pancreas. Okay, that's why I said anything that will affect the pancreas can eventually affect the bowel and vice versa. But I've itemized the causes in this. Causes due to the lumen, due to the ducts, okay? Causes due to the walls, and causes from outside, okay? Causes due to the lumen may be due to gallstones in the common bile duct, over cysts, ascaris worms, okay, hydatid cysts of the biliary tree, and stones in the pancreatic duct or common bile duct junction. So anything that obstructs the flow of bile can cause obstructive jaundice. Okay, hydatid cysts, a cyst. This is the larva form of the tapeworm, which may lodge in various body sites, not only the ducts, but even other parts of the body. Okay. The other one can affect the walls of these gallbladder, the walls of the pancreas, the walls of the ducts. Okay, like for example, periampullary carcinoma, bile duct stricture, okay, stenosis of the sphincter of Oddi, Claskin tumors, that is carcinoma of the bile duct where right and left ducts they join. There is a choledochal cyst affecting if you remember, we said this is the lymphatics, and laparoscopy cholecystectomy. Post laparoscopy cholecystectomy. Okay, this is a minimally invasive surgery to remove the gallbladder. Okay. Others are causes from the outside the biliary system, like carcinoma head of the pancreas, which can add pressure on the on the secretion of bile, chronic pancreatitis, lymph nodes at the portohepatic hepatis obstructing the biliary tree. Okay, although this is the pathophysiology is a topic on its own, but it's just important to see the overview of the obstructive jaundice. This is called surgical jaundice. It's the one that actually to treat it, surgery has to happen. Okay, this is a hydrated seat I'm talking about. Dog ingestion of the cyst formation in liver and lungs. Okay, can affect the human and gets engorged in these ducts. Some of the clinical presentation of jaundice is yellow discoloration of the skin, mucous membrane, and the sclera, light colored stool, okay, dark colored urine, itching of the skin. Your skin starts to itch because of what? Because of the bile salts. Okay, they cause itchy skin, nausea and vomiting. Okay, these salts, bilirubin, are accumulating in the circulatory system. So these will be picked by the chemoreceptor trigger zones, which are the vomiting center. It can cause abdominal pain, fever, weakness, loss of appetite, headache, confusion, swelling of the legs and abdomen. Okay, so take note of these symptoms. Okay, finally, this diagram shows which is the common feature of factor causing jaundice is the showing causes of renal stones. What can cause gallstones? Too much absorption of water. We know the gallbladder is involved in concentration of bile. So too much water absorption. Too much absorption of bile acids from bile. And too much cholesterol in the bile and inflammation of the epithelium. Otherwise, thank you very much. Thank you for your attention. So basically, I've talked about important things regarding the pancreas and the gallbladder. Okay, I've talked about the anatomy of the gallbladder. I've talked about the physiology, what it does. I've talked about the disorders affecting the gallbladder and the biliary tree. And I've talked about jaundice. Okay. I've given an overview. Next time, I'm going to give you the specific, detailed physiology regarding this information which I've talked about. Thank you very much. God bless.